Hello, my name is Dr. Tiana Curry-McCoy, and I'm going to talk to you today about research guidelines for radiation therapy students. The ASRT, which is the American Society of Radiologic Technologists, has several types of manuscripts that they generally accept for their different publications. The ASRT journal has things such as short reports, original research, literature review, and case reports. Let's talk about each one of these. A short report. A short report is not peer-reviewed. It is reviewed by one radiologic technologist, but not more than one. So it's not considered a peer-reviewed type of report. It is a contribution to your field, and short reports can be technical and casual. They're going to include things such as tables or images and other types of supplemental materials. Short reports are AMA referenced, and if you don't know what AMA style referencing is, please look at the alpurdue.edu website, which gives you information about AMA style references and other style references. Short reports, here's a general listing of some short reports and word countage and examples of the description and what a short report type would be. So I'm sure if you look at some of your journals within radiation therapy, you'll see different various short reports. So peer-reviewed articles are going to include your original research, literature review, and case reports. These are reviewed by at least 2 editorial review board members. They're scholarly in knowledge, and they're going to help build towards academic literature moving into the future. Only original work is accepted and that should not be considered by any other publisher at the time that it is submitted to one publication. So when we talk about original research, it's creative, it's doable, and it has future endeavors. So original research, we're going to have an abstract. This abstract is going to give us a brief summary of what we're looking at in the article. We are also going to have all of our authors listed with their academic credentials. When it's published, it's going to have the date to indicate when it was peer-reviewed. Okay. We're going to have an introduction. Your introduction is going to give the background and the build-up as to what you're researching and why we're researching it and why it's so important. Materials and methods. Our materials and methods need to be extensive in the fact that if somebody else was going to pick up this article and want to duplicate this research, they're giving a roadmap with your materials and methods section that they can use to go back and duplicate exactly what you've done. Data analysis. This is when you're going to look at all the data you got from your different assays and various methods that you use, and you're going to analyze it, and you'll be looking at what you observed, what increased, what decreased, what you compared as far as if you compare biomarkers or different radiation techniques, those sorts of things. Your results. Your results is where you're going to really kind of state what we got, what our traps were, where our pitfalls were, what we looked at as far as our N number, if we didn't have enough data, those sorts of things. Our discussion is when we're going to link it back. We're going to link our discussion back to our introduction. So you might pull different references and resources that you had in your introduction to come together in your discussion, because this is where you're going to say what I did and how it compares to what others have done and how my information, what I research, is showing something new. Your references. Your references are going to be all the different articles and the different research that you reference. Normally in your introduction, you might have some references in your materials and methods section if you're referencing another assay that has been performed many times, so you don't need to detail out the steps of this assay because it's referenced in a standing paper that everybody uses. This is the way we do this procedure. You would also have references in your discussion section. So, literature review. Literature review is where we're going to pull together different articles on a specific topic, and then we are going to state how those articles, how we're presenting this body of knowledge to basically give us a summary of maybe what's happened over the past 20 years or the past 10 years of how we've developed a certain technique or how certain techniques compare to each other, that sort of thing. So, we're going to determine the scope of our literature review. We need to understand the timeline and compile the research. The scope is very important because we want to have something that's doable and not that's above and beyond what we could ever imagine. Okay, so when we look at our literature review, let's say we do a comparison of the radiation treatment for prostate cancer over the past 50 years. That's doable. Okay, if we were looking at the radiation therapy treatment for 10 different cancers over the past 75 years, that might not be doable. That's a big, huge, broad scope. Okay, then we need to understand the timeline of our literature review. So we need to understand, if we're doing our prostate cancer and we're looking at the past 50 years, we need to understand what new techniques came in and when those techniques came in, when they were developed, okay, when the treatments were developed and how those affected the patients. We could even be looking at when treatments were approved and then methodology was implemented into our actual patients and into the actual practice of this treatment. And then compiling our research. So we're going to look at scholarly articles. We're also going to look at research that has possibly been done at certain hospitals or certain facilities, but we want to make sure that the articles and the data and the information we're getting is scholarly. We don't want information from Wikipedia, let's say, okay? So our steps in our literature review, we're going to select our topic. We want to know what our topic is, and we want to make sure that our topic is defined so that our reader knows what exactly we're looking at. And we're going to search for our literature about this topic. So you may end up looking at 100 articles for a literature review, okay? A literature review, we need to be comprehensive and extensive. We don't want to say we're looking at the treatment for prostate cancer over the past 50 years and I only have 5 articles. That's not going to cut it, okay? Then we need to develop an argument. So why is the treatment method that we're using currently a good method? Was there a previous method that actually had better outcomes for prostate cancer, but this current method we changed because it was financially more doable in the country, but the outcomes are maybe 5% worse than what the other treatment is. So we need to look at that. What are these arguments that we're presenting? And then we need to survey the literature, okay? So we need to look at the literature that we've searched up, look and see which articles are pro the one type of treatment versus the other type of treatment, which articles are telling me possibly about the finances and this is the reason why it was converted versus the economic cost somewhere else. Those types of things we need to be looking for with our articles. Who's giving me the pros, who's giving me the cons. Then we're going to critique our literature. Maybe a certain articles were published, but they were funded by a pharmaceutical company. So that's why these articles are leaning towards this specific treatment and the other articles aren't. Those are the types of things we need to look at when we critique our literature. We're going to look for biases in the literature. Then we're going to write our review, okay? So writing our review, remember, we still need our introduction. So we're going to be talking about our timeline. We're going to be talking about these different treatment options and methods. We're going to have our subsections, which are going to be specific for an outline that we created. A case report. So the format for the case report, it's a little bit similar to the original article. So we're going to have our abstract, we'll have our introduction section, which gives us a brief overview of the subject, right? Then we're going to have the case. So instead of having our original research that we looked at with our material methods and all that, we will have the actual case. So this is the case that we're going to present and report upon. Then we're going to have a discussion. So the discussion part is very, very crucial to the report, where we're looking at the theories and the research behind the findings of this patient's condition that we mentioned, okay? This is where we're going to have citations with our literature review as to how we got to this case and what all is happening inside of this case. Then we're going to have a conclusion. So our conclusion section is going to give key points about the case. We're going to give a brief overview again, and we're going to incorporate the suggestions that we have and recommendations that we have as to what has happened with this case or with this particular patient, okay? Then we're going to do our literature review, which is our bibliography. So we're going to have the articles that we used to review and that we talked about in our discussion and our introduction. So our research. When we look at our research, we want to make sure that we are we understand the scope of what we're looking at. We want to pick the best article for us in the timeline that is doable, that we can actually publish this article. So what type of research is good and is doable for me when I'm looking at a publication? Okay, I have 4 items that I can choose from. So which one of these can I actually accomplish? Okay, then we want to make sure that we have our timeline specified of how we're going to do our research, how we're going to get our items out there, if we're going to do a case report, if we're going to do original research, how long is it going to take me to actually dive into the material and methods or to actually accomplish the assays? How long is it going to take me to look at my literature review and to review 100 articles, okay? We want to make sure that we can have our subject matter that is going to count and is going to build upon the already existing research and literature that we have out there. Because if the subject matter is not going to increase the knowledge, then our subject matter is not something that is going to be publishable. And then ultimately, why are we doing this research? Okay, are we doing this research for a class? Are we doing this research because I'm currently in the employment as a radiation technologist and this is a case that I felt like needed to be shared with the world? Are we doing this research because we're added onto a research project for a doctor and they need radiation technologists to assist in their research? There's all different reasons to be doing the research. But ultimately, what is our research accomplishing? Whether we're a student, whether we're a professional, we're building our resume. And we're building our resume to move forward into to achieve our academic goals and to increase us professionally. So, with that in mind, here are some of the tools and techniques and ideas that you can bring forth to expand scholarly research. Thank you for your time.